Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Today we're looking at the Reese Ellsworth classification, and this is of the retinoblastoma. So Ellsworth classification, this is nothing but about the retinoblastoma. So there is 5 groups. So we need to know that there are 5 groups of this. So let's look at each group. So in this retinoblastoma classification, first will be the very favorable and the fifth one will be highly unfavorable. So first one, the group 1, it includes very favorable. So very favorable, what are the features? It includes a solitary tumor. So it is solitary tumor and it is less than 4 dd. It will be less than 4 dd. Next is it is at or behind the equator. It can be at or behind the equator. Next is there is multiple tumors can be present. There can be multiple tumors and they all must be less than 4 dd. So they are less than 4 dd. So they are less than 4 dd and all at or behind the equator. So they are present at or behind the equator. So it is at or behind the equator. Next is we move on to the second type. So under the second variety, what are the features? So second variety means it is favorable. So under favorable, what are the characteristics? So it is again a solitary tumor and it includes 4 to 10. So it is 4 to 10 dd and it is again at or behind the equator. So it is at or behind. It is at or behind the equator and there is multiple tumors. Second category, it includes multiple tumors. So when you look at multiple, it will be all. So all are at 4 to 10. So all are 4 to 10 dd, all are behind the equator. So favorable means there is a solitary tumor 4 to 10 dd, it is at or behind the equator. Then multiple tumors are 4 to 10 dd, they are all behind the equator, all behind the equator. Next is we look at the third variety. So this third variety means it is possible. So possible, there is it means that there is any lesion anterior to the equator. There is any lesion which is anterior to the equator. So it is any lesion which is anterior to the equator. It is a solitary tumor. It is a solitary tumor and that is greater than 10 dd behind the equator. It is a solitary tumor. It is greater than 10. It is greater than 10 dd and it is behind the equator. Next we are looking at the fourth. The fourth means it is unfavorable. It is unfavorable. So what do you mean by unfavorable? There it includes multiple tumors. So that means there is multiple. So as it becomes unfavorable, there are multiple tumors. So it is multiple tumors and it is greater than 10 dd. So this will be greater than 10 dd. And any lesions extending anterior to the ora serrata. So it includes any lesion which extends anterior to that of the ora serrata. Next is we look at the fifth variety. The fifth variety, it stands for the highly unfavorable. So it is highly unfavorable. So highly unfavorable, it means that there are massive tumors. So the prognosis here is now highly unfavorable. That is a very bad prognosis. So in highly unfavorable, there is the massive tumors. It involves more than 1/2 of the retina. So massive, and it is greater than half of the retina, greater than 1/2. That is half of the retina, and there has presence of the vitreous seeding. Vitreous seeding is seen. To learn and grow daily like this, please do subscribe.